You're listening to PetLifeRadio.com.
Welcome to My Dog Digs Dirt. I'm Lauren Collier, your host. If you have questions about your pet's health, you've come to the right place. On today's show, my guest is veterinarian Dr. Melissa Shapiro, who will answer some of you, our listeners' questions, and you'll find out about Dr. Shapiro's somewhat unusual practice. Stay tuned. My Dog Digs Dirt is coming right back.
You know that feeling when you go to clean the litter box and it's a complete disaster? Yeah, we've got you covered. Introducing World's Best Cat Litter Zero Mess, the advanced litter that gives you 2 times better clumping and more odor control with less litter. Zero Mess combines the concentrated power of corn with super absorbent plant fibers. Translation, scoop once and you're done. Find it at a pet store near you and save $2. Visit www.saveonworldsbest.com.
Let's Talk Pets on PetLifeRadio.com.
My Dog Digs Dirt is back. Please welcome my guest, Dr. Melissa Shapiro, who is the owner and founder of a somewhat unusual veterinary practice called the Visiting Vet Service. Very happy to have you here, doctor. I just love this idea. You come to the patient rather than them coming to the office. I bet you a lot of people really appreciate this, and a lot of pets as well.
Yes, they do, actually. I see a lot of older animals, lots of dogs that can't get out of the house anymore. But I also see many young puppies and kittens with people that just want to have a more personal, individualized type of vet care for their animals.
So is that how you decided to do this? Because you've been a vet for a long time. And did you see a need for this?
No, it was a long time ago because I'm having my 26th anniversary this coming May of my...
Wow, congratulations.
Oh, thank you. But I was looking to do something other than opening a practice. And there was only one other vet doing house calls at the time, and it seemed like a really good idea. So I just started doing house calls, and it within 6 months I had a full-time house call practice.
Oh, I bet.
And the idea was catchy, but it also, there's a place for it. It's not for everybody, and it's not for every animal because many aren't good house call patients. But routine things, older animals, there are places for it, but hospitals are still important for various diagnostics and procedures. So I work with an animal hospital out of one where I do those, that aspect of the practice.
Of course, if there was something that needed to have a follow-up, then they might have to go to the hospital. But for an initial visit or you following up, I think this would be really helpful to some animals who are really afraid to go, and also folks that might have a hard time getting out of their homes.
Yes, it does help. I don't have a mobile unit, which, there are many, many vets that have a whole full-service mobile unit, so they do surgery and these sorts of things. I don't. I never did. And I like to keep it simple. I go to the house. I can do, I can blood from animals. I don't have a tech normally, but traveling with me. But if I need, I do have someone that will come with me to do a little bit more than I can do just by myself on certain dogs and cats. But for the most part, it works well. Sometimes people leave the door open and I go in and take care of the animals myself.
Wow.
If someone's sick, we determine by phone earlier before we set up the house call whether it's something that should be seen at the hospital or not. So, it's a mix and a match, and it's worked really well because I've been doing it for a really long time. Over the past few years, I've been doing much, much more senior and special needs pet care in the house, which has worked out very, very well for so many. People just end up not bringing them at all to the vet because they can't get them out of the house. They don't want to put an old dog through it, the travel and the stress and anxiety, and I go to the house, and we can do so much for them in the house. And one of the things I do is when I walk in, I can scope out the living conditions and the environment that some of these really old arthritic dogs are subjected to. They are walking on really slippery floors. They can't even stand up to eat because their feet are slipping out. And it's a simple fix. I just walk in and I say, hey, runners, carpeting, and people aren't even thinking in those terms. So just a simple thing like that, a house call makes a big difference.
I think that's terrific. And you are a huge animal lover as well as being a vet. I know you rescued, there's at least 6 dogs you have, 3 house sparrows, and even a disabled parrot. So you really stand by what you do. I really respect that. I think it's wonderful. So you probably get asked questions all the time. I always think of like a shrink with friends. They're like, will you help me? So I'm sure like when you're with people, they're like, can you tell me this question? We have questions from our listeners. So I just want to go over a couple of those with you, Doctor. The first one is, what is a good comprehensive vet exam consist of? What would you say if somebody's going for that? What should they look for? What should they ask for?
Well, say the yearly checkup where you just, you're going to go over everything. It's the yearly checkup like you would bring your child into the pediatrician. You first want to have a discussion. How is the pet doing? Eating well, drinking normally, not drinking too much. Urinating, in the house versus outside, too much urine, too big spots in the kitty litter. These are indications that there are problems. So you have first a conversation, weight, has the weight changed, appetite, all these kinds of things as you would with a person. Then I usually do a full exam. I start from the nose and I go work my way back. And it can take anywhere from a few minutes to much longer, depending on the cooperation of the dog or the cat. And so, looking at the teeth, the ears, the eyes, the gums in the mouth, lymph nodes, heart, lungs, abdomen, feeling for masses, enlargement of various organs, looking at the skin, the musculature, is there muscle wasting, is, just the general body condition normal for that age? Have things changed since last year? I always do a rectal exam, which people kind of laugh about, but there are anal glands back there that can be full and infected, but also there are tumors that you would never know until they get very large. So if we find that sort of things early, we can prevent problems later on. So that's what I do. And that's a full exam. And then if there are vaccines to be given, we do that. Preventatives for heartworm, various the ticks and fleas. There are various products that we can use. And then, just an overall plan for what's going to happen from here. What are you doing when you go home? Is there a special diet? Other accommodations that need to be made? Maybe blood work. I always recommend doing a yearly blood screen to look for changes in the liver and kidney values. Every now and then we get a big surprise. I saw a dog the other day. He actually didn't feel good, but he was having neck problems. I did a blood screen and found that his thyroid levels were very low and he's hypothyroid. Wow. So just on a blood exam that I was looking for other things, I found something else to treat. So, it's always a good idea to have baseline blood work and follow up year to year. Many veterinarians are doing titers for vaccines rather than giving vaccines for the viruses that we vaccinate for, and that's another option.
Okay, so that would be something you're saying that once a year would be a good idea.
At least once a year. As the animals get older, it's really nice to do even more blood work. And I always feel guilty spending people's money, and then I think, we might be saving a life. But saving a lot of money when we find a disease that's treatable now and maybe not later on.
Right, exactly. Okay, here's another one. Should I give my dog flea medicine even though it seems toxic?
I knew that was going to come up. I think you need to weigh your options. I'm middle of the road. I have to be really honest. During the heavy tick seasons, I do give my dogs poison. And I call it poison because I'm giving them chemicals. I can't bear the thought of seeing them get sick with Lyme or Ehrlichia or some of the other tick-borne types of diseases. You can be only so careful. I have a backyard that's fenced. The dogs are not in the woods, but there are animals still coming in. I walk my dogs on the street, and I don't let them go into brush on the side of the road. We don't even go to a park. But those dogs that are going into the parks and have wooded areas where there are ticks, they are going to get ticks, and if they're not doing something to prevent tick bites, I would say a large percentage of them are going to get sick with Lyme or Ehrlichia. There is a Lyme vaccine. It's relatively effective. Some people don't want to give that because they don't want to over-vaccinate. So you need to kind of feel your comfort zone. There are lots of natural products that you can use. There's a terrestrial collar that works very nicely for some. I don't have a lot of experience with it. There are oral powders and supplements that can be given also to dissuade ticks from staying on the dog or cat. Everyone has their own approach to this. And by the way, the chemicals are not 100% effective either. You don't give them properly. Some animals are just so infested that, you need to use sprays and other things. So I suggest talking to your veterinarian.
Yeah, that's a
and
tough
others
one.
that you trust.
That's a tough one, yeah. Okay, how about this? Here's one other before we go to break. Is dental work really needed? 10 years ago, my dog you just kind of let your dog go and they were fine. But now it seems like I keep getting pushed to get a dental exam and a cleaning. Do you feel that's really needed?
Yes, it is absolutely necessary. To have dogs, just like a person or a cat, have severe dental disease predisposes them to all sorts of problems, all sorts of infections, just locally, as well as up into the ducts and salivary glands that go up towards the face. You see eye infections and just poor general health. It hurts. Why would you want your dog or cat, even though they'll still eat with their teeth, when they're just in the worst shape, they are having pain. Mm-hmm. So while good prophylactic care can prevent many from needing the anesthesia and the real dentistry, which does cost a lot of money and requires the anesthesia, there are things that can be done along the way, like brushing your dog's or cat's teeth. This is controversial within the vet world, having, the teeth scraped and scaled without anesthesia. But if you are only getting small amounts of tartar on the teeth, to give them a cleaning that way, there are people that travel around doing that. Some veterinarians do it. That's helpful in between so that you can prolong the amount of time in between the anesthesia type of dentistry.
Yeah.
But once they get to a certain point and there are extractions that are needed, it's necessary. It's just a part of taking care of your dog or cat.
Okay. All right. I mean, nobody likes going to the dentist, but I guess you got to go. All right. My dog digs dirt. We're going to take a short break, but Dr. Melissa Shapiro will be back with us from Visiting Vet Service, answering more of your questions right after this.
Everything we tried failed except the Dynovite.
The standard run-of-the-mill tests and treatments.
Cortisone,
antihistamine,
multiple creams, antibiotics, spray, multiple prescriptions,
steroid injections,
spray shots, antibiotics,
steroid cream.
No results.
It was neglect. The other owners didn't care enough about him to take care of him and to give him the nutrition he needed.
A nutritional supplement like Dynovite.
To be the healthy, happy dog he is today.
DINOVITE.com.
If you want the dog to be healthy, you got to feed it something healthy.
Put some nutrition in your dog.
The vet that I trust recommended Dynovite. The dog I have today, because of Dynovite, has a sparkle in his eye, a lush coat, healthy skin.
When you rescue a dog, you've got to feed him right for life.
Dynovite will make your dog a happy dog.
Dynovite is nutrition.
Dynovite for life.
859-428-1000.
859-428-1000.
DINOVITE.com.
Hi, I'm Dana Humphrey, the founder of Whitegate PR. We have been specializing in PR and marketing in the pet industry for over 10 years. If you have a pet product or service you would like to promote, give us a call. We can help create awareness for your brand on TV, radio, magazines, newspapers, and blogs. Feel free to reach me directly at 619-414-9307 or learn more on our website at whitegatepr.com or follow us on Facebook.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to My Dog Digs Dirt. We are here with Dr. Melissa Shapiro, who is answering some of your questions today. She is the founder of Visiting Vet Service. Thank you, Doctor. You've been answering these questions. Very, very helpful. Here is another one that a listener sent in to me. How fat is too fat? And I must say I have to relate with this because I have a Bouvier, which I talk about in Noki. She's 132 pounds, and I just think of her as big bone. But every time I go to the vet, she says she's got to lose weight. So what is your opinion, and how do you know if your dog is fat? Is there a test, or you just visually see it, or, they're not active? What do you say to that?
Well, first of all, having a fat dog or cat is really unfortunate. There are many. I don't know why people need to have their animals fat and why they can't control how much food they're feeding them.
Right.
But somehow we see a lot of obese animals. It is really bad for the joints. It's really bad for the metabolism and all the systems. We see diabetes. We see, other illnesses related to being overweight. But the most important one that I think we see, especially as dogs and cats get older, is arthritis. And when they've got to lift up a big, heavy body, it's a lot more wear and tear and a lot more strain on their already compromised joints. So having them a normal weight as they get older, when they aren't even going to be able to exercise well anymore, is really important. So the way that I test, just as a rough test of weight, how overweight a dog or cat is. Dogs in particular, if you just run your hands over the sides of the chest,
okay.
If you can get a hint that there are ribs there, you don't have to feel every notch on every bone. But if you can feel that there are ribs there, then your dog is probably the right weight. Once you lose the ribs, they're a little bit over. And once there's no waist at all, then they're really fat. It's really important that you cut back. And one thing that's very, very important is not to put anyone on a crash diet, especially cats. Because cats can end up with all sorts of liver problems, which are very serious when put on a crash diet. So you always need to work with a vet or a veterinary nutritionist on weight loss for cats and also for dogs. It would be helpful.
Oh, that's good. Okay. And we have one more, and I'm listening, I promise. And it's about safety. Do you think that dog parks are safe, first of all? And for many there are. So, it's really broad. But the bigger question is, if you're walking your dog or you're at a dog park and your dog gets into a fight with another dog or, attacks your dog out of nowhere, what should you do? Is there a general rule here?
Yes, I have a few suggestions. First of all, dog parks are great for the dogs that they're great for. But dog parks aren't for all dogs. And one of the problems is that people feel that it's their right to be at a dog park with a lot of dogs that shouldn't be at a dog park. Dogs that get aggressive, they are, pushy, they get into cliques with other dogs. I don't even go to the dog parks with my dogs and I used to be an avid dog park person long ago, because I also don't want to deal with dogs that come running over, they're jumping on my dogs, they don't like it, it's a big hassle. So one of the things that I would suggest for people that do want to go is kind of have an idea of who's there and when. There are certain dogs that are there only at certain times during the day you might want to avoid. The other thing I would do is pack a noisemaker. There are little canisters that you can spray that make a loud noise, or something to kind of ward off an attack. Once something's happening, you need to be careful not to get in the middle of it because you will get bitten. So, if you're in a yard, say at a doggy daycare, they've got hoses and spray bottles. I mean, it's a bit of a hassle to go to a park with spray bottles, but those are things that can at least break up a fight and startle the dog that's initiating.
Right.
The other thing to do is use leashes.
But I mean, if your dog is on a leash and the other isn't,
Yeah. It's tough because you don't know when it's going to happen.
Exactly.
So if you're there and you can see, I would just turn around and go walk the other way. You can certainly pick up small dogs. I wouldn't have food in my pocket. One of my dogs actually was attacked by a dog, and I think that the reason was that I had one of my kids with me in a stroller, and she had dog treats. And I think the other dog smelled the dog treats and then went after my dog. So that's something that happened to us, and that was 20 years ago.
Yeah.
But I'm just trying to think if there's anything else.
Would you suggest taking pepper spray or something like that, or?
I would be careful. You don't want to injure someone else's dog, but there are different kinds of sprays that are safe. there are the noisy, I don't know what the name of it is now. I had
Mm-hmm. Okay.
here. But it's in a red canister that you can spritz, and it just makes a really loud noise, like an air horn.
So it might startle them.
And I would, I would do that kind of thing. If you put a small spray bottle in your pocket, if you're worried. But if it's a park that there's a lot of aggression, then I would just stay away. And people with small dogs in particular have to be really careful. Your dog is huge.
Right.
So there's not many dogs that are going to do too much damage. But the smaller dogs, big dog, little dog encounters are very, very serious.
You have to be so careful, yeah.
So the other thing is I would be very careful about allowing your dog to go with pet sitters and dog walkers to parks.
That's a very good point.
They go with more than one dog, and sometimes they go with 6 and let them off the leash. And your dog might get into a fight, and then they've got 5 other dogs on the side. And where are those dogs going?
I think that's a very good point. And make if you do go with somebody like that, because we're not trying to say that the dog walkers there's anything wrong with them, but you really need to ask questions. Because I have seen dog walkers, and the dogs are they just let them go. It's crazy, right? Yeah. So you really have to.
I have a client that the dog kept running off. She was injured 2 times at a park, and I finally said to the owner, enough already. Go find a daycare that's in a building.
Yeah. That's a good suggestion.
The woman, she had 6 dogs. She let them go and off in the woods, and they were running rampant. And I don't know. I don't think that's safe. I have a big problem with that. So I think it's really important to know who you're handing your dog off to and what exactly they're doing. And that's another problem in the dog parks, because they have dogs that are not under their control. There's too many per person. So those are, there are parks with fenced areas, and there are safer ways to exercise your dogs than just, going to just any dog park.
Yeah, you have to really keep your eyes open. Okay, finally, I know this is a technique that you use in your practice. What do you think about laser therapy?
Oh, I love my laser.
I know you like it, but
I was having my own back
who benefits from
the
it?
other day, and,
who benefits from it? What type of dog might seek that out as a treatment, or cat?
First of all, other dogs, I use my own laser for myself. And so I know it works really well because I have back problems, and when it's really bad, I use the laser. So I personally have experienced it, so I have an idea of how to use it and how to work it. Most of the dogs that I use it on are older, arthritic, usually larger dogs. Not always, but most of them either have back or hip problems, sometimes knees. And after 6 treatments over 3 weeks, people are usually very, very comfortable saying, it has helped.
Wow.
One example is a 15-year-old shepherd mix that I take care of that has terrible arthritis. She was having trouble. We started her on medication, some supplements. She takes adequate injections. And then she was continuing to get worse to the point that she didn't want to walk down the stairs, which are carpeted. And it's only about 5 stairs. So I started doing the laser. And when she has her laser treatments, it lasts just so long. Usually I go every few weeks now to give her laser treatments. She doesn't hesitate to go down the stairs anymore.
Oh, that's
great.
So
it's very noticeable to the owners that it is definitely helping, and they can see when she needs another treatment. And I've had other situations like that where people it's usually subtle. It doesn't make the old dog into a 2-year-old dog, but it gives them relief and it just makes them move a little bit easier, get up and down a little bit easier. Sometimes if there's an injury, the injury can be, resolved, and the laser will help. Also, we use the laser for various infections and anal gland abscesses in particular. I have found it to be very, very helpful for chronic anal gland irritation. We use it for that, and it will keep things more settled than it's shocking how much better the dogs feel. And then also different wounds. You have a wound and it's sewn up. The laser will help it heal more quickly. So I'm using it more and more. I just got a new laser, which is called a K Laser, is the brand, and I've been overly impressed with it. So I don't mind pushing it.
Oh, Noelle, we're happy, to hear your opinion, and it's terrific. And once again, Dr. Melissa Shapiro, where can people find you? I know you're really basically in Connecticut, and it's the Visiting Vet Service. But let us know how we can get in touch with you.
Well, I have a website, which is visitingvetservice.com. And on there is my contact information. So I work mostly in Lower Fairfield County, Norwalk, probably Fairfield down through, lower into Stamford and Greenwich. And then I also have Your Senior Pets Vet, which also has a website called yourseniorpetsvet.com. And that is the service that I have. It's a subdivision, really. It's the same. It's just me. of my regular house call practice that caters really toward senior and special needs pets. So both websites have all the information to contact me through email, mshapirodvn@gmail. And then I have phone numbers, and I'm happy to, help is looking.
Fantastic. You're a huge help. I'm so thrilled to have you on the show. So I thank you so much. Once again, Dr. Melissa Shapiro, thank you so much from the visitingvetservice.com. And thank you, all of you out there, for listening and for your questions. Please continue to email me. I'm Lauren Collier. This has been My Dog Digs Dirt.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.